So here's an uncomfortable one that no one wants to talk about, at least I don't, but we have to. You brought up libido. Explain how things are changing and what we can do to feel better.
Yeah. I mean, the conversation I have around libido is always the sort of start with it's complex, right? Libido for women, it's complex and it's multifactorial. Um, and I think my own perspectives on this, the more and longer I do menopause care, the more patients I take care of, um, are to say there's absolutely a hormonal piece to this, right? So, it's certainly there's stuff out there about duration of relationship, getting bored, right? I mean, it doesn't happen to men in the same way as this data says it happens to women. The load of things we're carrying. So, someone else already brought up sandwiching, right? If you're anxious about the world, if you're stressed, if you don't have time, that affects libido. So, yes, there are a lot of things that go into it. But then certainly there are patients for whom they hit perimenopause or menopause and their libido changes. I think there's a lot we still don't know. I mean, I have a patient who had a thyroidectomy for thyroid cancer who told me one day she had a libido and then the day after her thyroidectomy, she didn't. And no one will listen to her about finding the ideal range of where her thyroid should be. And I think there's a lot we still don't know.
Yeah.
But certainly there are hormonal pieces to libido. And I talk about how estrogen is a sex hormone, and so is testosterone. And both of those things are normal in our bodies. And so we don't know what everybody is going to respond to. There is no one size fits all approach. We know that couples counseling and sex therapy can absolutely help some people. Even just the focus on the relationship is part of what can help build connection, right? There's things like scheduling sex, which is not the most fun, but women can, if they are, I mean, I'm not joking, right?
Yeah.
There's the studies on sexual response cycle kind of suggest men have to be interested to become aroused. That's not necessarily the case with women. And many of us want to feel interested and initiate sex, right? It makes us feel like ourselves for some of us. Everybody's libido is different, I'm just going to say, right? There's no normal. And it's only a problem if it's a source of stress for you or a source of tension in your relationship, right? It's normal for things to wax and wane. But also sometimes hormones are the answer. And sometimes they give people estrogen and their libido comes back. Sometimes it's not until a higher dose of estrogen after everything else feels the same. And this is not science backed. This is my anecdotal clinician experience.
We like it when you go
Under
off script.
the radar. I know. You guys didn't know you had me up here about to bring everything up. So I find sometimes, right, if your hot flashes are gone and you're sleeping better, that's like the minimum bar. We give a little more estrogen and libido starts to wake up. Doesn't always, sometimes it does. Testosterone, the data says sort of 1 to 2 more satisfying sexual events a month for a postmenopausal patient. Is that enough? I don't know. But I think also we want to feel better. And sometimes testosterone, we buy in, and I don't really care if it's a placebo effect. If someone feels like their life is better, if we're being safe and managing it appropriately, sometimes there's a role for that. But I have that conversation with people, right? I'm not going to say this is absolutely going to fix things for you.
Sure.
And I think we're going to learn more over time.